First of all, I wish to express my thanks to you, Count Corla, for selecting this important issue for debate this evening. Overcrowding at the A&E department at UHL continues to be a major problem. For the past 2 months alone, there has been a staggering 900 patients on trolleys, the highest recorded in the country. There are many contributory factors to this, including the fact that some surgical theatres and consultants are not available 7 days a week. But the major issue is a lack of acute bed capacity in the region. In fairness to management at UHL, they've put forward 2 projects to significantly boost the bed capacity: a 60-bed modular unit and a new 96-bed block proposal. The 60-bed modular unit was recently granted full planning permission by Limerick City and County Council. However, it's extremely regrettable that this vital project has been stalled because of a planning objection by a resident of Dáil in Limerick. This project is of critical importance to health provision in the Midwest region, servicing counties Clare, Limerick and North Tipperary, as it will improve patient flow throughout the hospital. It will improve patient comfort, patient safety, privacy and patient dignity. It's outrageous, in my view, that one individual can hold up a project of such importance. I've taken up this matter with the Minister responsible for planning, Minister Damien English. It's my view that the strategic projects such as this should be lodged directly to Bord Pleanála. While I have no wish to deprive people of the right to appeal against planning decisions, it's my view that it makes sense to give Bord Pleanála the right to deal directly with applications for major public service projects. As such, an approach would streamline the process and allow people to have their views considered without compromising the public interest. Minister, what's your position in relation to this particular project? And with winter almost upon us, what contingency plans are there in place to deal with the severe overcrowding at UHL? And finally, I strongly believe that more can be done and more needs to be done with the smaller hospitals in the region, including at Ennis, Nina and St John's. Do you agree with this, and what plans do you have to involve them more?
Deputy Neville.
Yeah, thank you, Count Corla, and I'd like to just follow on from Deputy Carey supporting what he has said in relation to the smaller hospitals or the sister hospitals that are based in University Hospital group in the Midwest. Obviously, we've been told to use those facilities, particularly around injury clinics. I know myself that if I'm injured myself in a match or whatever, the first place I'll think of as UHL is in Dáil. We don't know what specifics are in relation to the other hospitals, be it St John's, Ennis or Nina. And I think there needs to be a huge communication strategy put in place in relation to that, so those facilities are used to their capacity to try and take the heat off the emergency department in Dáil. I think that communication plan, I've asked for it before, I think it's now paramount that this is done, given where we're at. I welcome the fact that the government have put the 96-bed unit, are moving on that project in conjunction with the hospital group itself. I think that has been at design phase at the moment, hopefully moving on to tendering phase quite soon. I'd like an outlay of the design timelines and that. But in relation to the modular unit, everyone has a right to appeal, everyone has a right to object. I have no problems with that. But in this process, we are looking for something so urgently here. I do echo Deputy Carey's sentiments that the likes of this should be straight to Bord Pleanála. That's no disrespect to the council, which I sat on for a number of years, but a strategic project of such a nature to just streamline and fast-track deadlines. We're talking a number of months here. When you're looking at, as Deputy Carey said, you're looking at 880 people on trolleys in June. You're looking at I think up to a 17% increase in the use of that emergency department over the last year and ramping up all the time. I'd like to hear the Minister's comments on that, and I'll follow on afterwards. Thank you.
Minister.
On behalf of Minister Simon Harris, I want to say I welcome this opportunity to address the House on this issue raised by Deputy Joe Carey and Deputy Tom Neville. And again, I want to commend Deputy Joe Carey for his great work on health in Clare and Deputy Tom Neville for his support for services all throughout Limerick. This government, as you know, is committed to breaking the cycle of overcrowding in our health service. Emergency department overcrowding has been linked to many adverse outcomes, such as longer wait times, worse patient outcomes, treatment delays and growing staff and patient dissatisfaction. The Emergency Department at University Hospital Limerick is one of the busiest in the country, with approximately 67,000 attendances annually. Demand for the ED services at the hospital continues to rise, with an increase of 6% in ED attendances in UHL in 2017 compared to 2016. The Department of Health undertook a health service capacity review in line with the programme for a partnership government commitment, the findings of which provide an evidence base for future capacity decisions. If reforms are implemented, the report concludes that nearly 2,600 additional hospital beds will be required by 2031. The National Development Plan provides for the full 2,600 beds by 2028, 3 years ahead of schedule. The National Development Plan announcement earlier this year includes the provision for a 96-bed replacement ward block at University Hospital Limerick. The HSE has provided capital funding in 2018 to progress the design phase of this particular project. Further funding will be considered in the context of the capital allocation for health, having regard to the availability of funding and level of contractual commitments already in place. Subject to funding and the successful completion of the planning, design and tender phases, it is currently anticipated that the construction is unlikely to commence before 2021. Given the current pressures on our hospital EDs, the Department of Health has engaged with the HSE to identify the location and mix of beds across the hospital system which can be opened and staffed this year and into 2019. A proposal from the HSE which identifies in the region of 600 additional acute beds and 200 additional residential care beds to be phased in between 2018 and 2020 is currently under consideration in the department. These proposals include a 60-bed modular unit at University Hospital Limerick. Therefore, while I understand the Deputy's wish to have a clear response today on the provision of additional beds in the UHL to alleviate the ongoing pressures on the ED, I must await the outcome of the processes currently underway. This includes matters which are being considered in the context of the 2019 estimates process. And of course, I will convey your sensible concerns and suggestions to Minister Simon Harris. Thank you.
Thank you very much, Minister. Deputy Carey.
Thanks very much, Minister McGrath. And you know, Ennis General Hospital is a vital cog in the wheel here, and I believe more could be done in Ennis in terms of trying to reduce the burden that's on UHL. And I welcome the fact that Clare County Council recently granted planning permission to the hospital group to develop a new outpatients department just off the Kilrush Road in Ennis. We need to see further investment in Ennis General, particularly in the surgical theatres there, and an expansion in the opening hours of the medical assessment unit and the minor injuries clinics. And I know that, you know, Minister Harris in particular has a view that smaller hospitals can play a bigger role. And I'd like to ask you, Minister McGrath, would you support that? And would you convey, you know, the opinion being expressed here this evening that the smaller hospitals, the modular 2 hospitals in the region need to be resourced more so they can play a bigger role?
Thank you very much, Deputy. Neville.
Yeah, thank you, Kilcorla. I just want to reiterate again, Minister, that we need this speeded up as quickly as possible. Dates are being shifted out all the time from what I hear. You're saying now today that it will commence in 2021. We need to get this moving faster. What I'm asking here in relation to the process is if we can find a fast track in relation to dealing with the person who's appealing this and on Bord Pleanála and the Minister to sit down, iron out their differences and come up with a solution here that we can move this forward, because people are lying on trolleys, they're under bright lights, their privacy is being compromised. I've had phone calls this weekend in relation to some specific cases. Some people are on trolleys 3 and 4 days, Minister, and we're dealing with this for a quite considerable long period of time. I would also suggest as well in relation to diagnostics that there will be something looked at in relation to diagnostics, that we move beyond a 9 to 5 Monday to Friday model, like that has happened in the private sector, that you move to a weekend shift and remunerate it and bonuses paid accordingly in relation to shift allowance. We need to start thinking differently in relation to this, Minister. It's getting too serious there, and I would ask, and I would also finally like to pay tribute to the staff who are working under extreme pressure there. 67,800 attendees attended that A&E last year. I understand that we're talking about the C cases, which are at the very end of the process, the most acute at the end of the process, where we're trying to take the beds. But I also want to commend the staff because and the management, because a huge volume has passed through there, Minister. But this is essential we get this through ASAP.
All right, Minister, to conclude on this matter.
Thank you, Concordia. Again, I want to thank the deputies for raising this very, very important issue. And of course, there are many, many points that I strongly support. For example, Deputy Joe Carey talks about Éireann General Hospital and ending the burden. I agree with that, and also the issue of the medical assessment unit. And the answer is, do I agree with smaller hospitals can play a bigger role in dealing with this issue? Absolutely, 100% yes. And will I bring that view to the Cabinet and to Minister Harris? Absolutely. Deputy Tom Neville talks about speeding up the process and fast-tracking the whole issue of Bord Pleanála. This is something that we have to act on about it. I agree it's not acceptable to have patients in trolleys for 2 or 3 days. And also, we need to be more proactive in relation to thinking differently, and I think that's very important when we're planning to design the health service. But can I also say the health service capacity review indicates that Ireland has among the highest acute bed occupancy rates in the developed world at 94%, significantly ahead of the OECD average of 77%. This is why the government has approved a record level of capital investment in health at 10.9 billion over the next 10 years. This will provide for major enhancement of the capacity of our health services to meet the demand as raised by the deputies. However, increasing capacity alone will not address the challenges faced by the health system. Investment and reform must go hand in hand. The Sláinte Care Implementation Strategy, which was recently published, provides the framework for how our health service reforms can be realised across primary and social care as well as acute care. We now have commenced the implementation of the Sláinte Care programme of government. To conclude, Concordia, by saying we all acknowledge the challenges that we face are significant, and of that there is little doubt. However, it is my firm belief that all of us here, we want to find the right solutions. I've heard some of your suggestions today, but they have to be patient-centred, evidence-based, results-focused and sustainable to the challenges currently facing our health services.
Thank you very much.
Thank you, Concordia.
And that ends